where you have find India in this scenario of an international platform if it talks about of health and anything related?
Sure. So frankly, India is clearly one of the most emerging destinations for healthcare. Given the currency of the world today is going to be data. The sheer volume of cases that we have in India are much more than many other countries in the world. So we see a lot more of that of innovation coming, given the fact that we also have a very large information technology services, set up in India. Multiple companies that are doing innovation in that space. So if we are able to really, synergize the efforts of the IT companies with healthcare innovation, we should see a very bright future. So, as I see it, huge potential. We still have to kind of realize it over the coming years. We still are seeing a lot more of the legacy systems that have been there in the healthcare sector. But slowly but surely, we are seeing a lot of new age companies, new age technologies, really, making a big difference, in the healthcare sector.
So in terms of Max, if we talk about innovation has taken a many horizons, and Max is always a part of technology, and they just always try to pace up with the things. Who all the target vendors you think who will come forward for to help Max to enhance in terms of technology?
So there are many vendors. And frankly, we are all looking at multiple areas, and what we'd really like to do is to create an ecosystem for healthcare innovation. So we are allowing new partners, new applications to basically benefit the customer. So frankly, it is about the customer, and whichever partners, whichever vendors can help us in that is useful. So we are looking at very specialized apps. We are looking at specialized apps in various fields, including diabetes, including oncology, including so various areas, specialized apps around that. We're looking at areas that would really help us improve customer experience. So applications that will probably be for patient engagement, that really improve the connect that we have with our patients. We were the first in the country to launch Microsoft Dynamics CRM, which was basically also very well received because it helped us get better information about the customers. And I think our vision is to really be able to send our customers back home faster, which is a very new paradigm shift in the industry, because we are saying we'd like to actually enable customers to go back home faster through better processes, through better technologies, through innovation. So that's what we're basically aspiring for, and we are looking at multiple partners to help us in that.
So technology provider like cloud, we talks about how far you think it will be helpful in terms of healthcare sector as far as Max concerned?
Well, I think cloud will play a very big role. We have to be cognizant of the fact that we will need flexibility, we will need agility, scalability as we have more and more customers, more and more records being added, to our data, to our information systems. So cloud is going to play a very important role. We are seeing increased usage of the internet by our customers. We are seeing a lot of them becoming very internet savvy. They demand customer service anytime, anywhere. So the cloud enables that. They allow them to basically get access to their information, their personal information faster. We're already doing some work in the clouds, with various applications. As I see it, the only thing we will need is some more focus on security. If you're able to enable that security standards, I would see cloud becoming extremely popular over the coming years in India, in the healthcare sector.
What security measures you likely to focus upon, what you were talking about?
Well, we're basically looking at data encryption, ensuring that the security of the data is paramount. We are making sure customers are kind of really, getting that, comfort that the data is protected. So some work around that. And as I see it, we will need, more attention, to this, to really enable the customer to have peace of mind. And from our side, while the security is critical, we also need to make it less difficult, to get information. So we have to balance both the security and convenience when we basically, undertake any initiative.
Sir, moving forward, I just wanted to ask how you manage big data management. It's a very important thing as far as healthcare concerned. So how you looked upon it, how you tackle the whole situation?
So big data is, healthcare sector is one of the best sectors, for big data.
Yeah.
Frankly, a lot of information, a lot of data that is already available. We have customers who have been, kind of taking our services for a very long time. And if you were to simply harvest that data well and, maybe understand the actual problems that they have, we can really enable wellness, for the customer. So frankly, our goal also is now to move more besides, curative treatment, to also move towards prevention and wellness. What can we do to prevent, illness from happening? So a lot of awareness and information campaigns being launched by Max. We're doing a lot of work in improving emergency services, a lot of work in extending care outside hospitals to their homes. So digital care, which enables us to get remotely connected to our patients and provide, them service there is being done, in a very big manner. So we are basically exploring possibilities by which the customers really do not need to, come to us, sometimes, because we know there is a lot of traffic issues and all of that, all over. How can we also reach out to them? How can we make their, their experience much more seamless and easier? There've been some very, good new initiatives that have been launched recently. The oncology daycare center, the digital care outside hospitals, which would help us in customer convenience.
So if we talk about, we have previous years when the health sector didn't grow too much, we had the tedious work of taking healthcare records. Now there's an electronic method of taking the healthcare records. How far you think it will be helpful in the case of for the patients and for the doctors also?
I think it'll be very useful. So frankly, today, patients have to struggle with all the documents, trying to find all their information and files, and they lose some of the information. There's a lot of problem between, hospitals also, if they have to travel to another doctor and they can't have access to the information they need. So it is a big need for customers. Electronic health record is critical. It's really, really important, to allow that access to be available. So, I mean, again, Max was the pioneer in starting this electronic health record. We implemented this in Max Saket and many other hospitals, in our network. And that actually is also now, we've tried, using iPads by which even doctors can actually access the information on, on mobile devices and tablets, on the electronic health record, which we hope to also extend to our patients. So a lot of the, the convenience that the patients want when they are kind of traveling to another hospital within Max, outside, they can actually have some access there. So we have a patient portal which allows them to see their records, on the web, and from our side also the doctors can also view it, on the move. So it would be a very useful thing when we are looking at the holistic treatment for the customer.
So as you are talking about the patients, if you talk about the vendor, could you please suggest some names? What sort of, say, vendors are there with the Max, and what you are looking forward for other vendors to join in hand with Max?
We have many partners. So we currently use, many marquee names. We use GE Healthcare, we use IBM, we use Wipro, quite a few big names there. Along with that, we're also looking at some startup, companies to foster innovation. So we are exploring some very interesting, applications, specialized apps, which would help us, in providing quality care on specific, specialities, specific disease management protocols, which we mentioned. So we are talking about, areas that will really help us, whether it is lifestyle diseases, for customers. We've recently announced a tie-up with Goki, which allows us to, kind of, again, extend care beyond, just the hospital. Can we actually also monitor the health of the patients, over a long term, and then provide, preventive care to them. So many new partners, many new, kind of vendors that we are exploring, which would improve customer experience.
So now you are in the part of healthcare conclave. How was your experience and how you find it for the testimony?
Well, it's a great conclave. I think very good to actually have so many esteemed speakers and esteemed people on on one platform. So thank you to the eHealth magazine to organize that. It just exposes us to new areas, new technologies, new innovations that are being worked upon, to see how we could leverage them to benefit our customer, our patients. So that's definitely very useful, very.
Thank you, sir.
Thank you.